As a parent, there's pretty much nothing more concerning than hearing your child struggle to breathe. That little cough you hear at night, that wheeze after they've been playing, it can be really worrying. But I want you to know you're not alone in this. Today, we're going to demystify childhood asthma and allergies, and our goal is to help turn that worry into confidence.
And this right here is the goal we're all aiming for. And it's completely 100% achievable. The point isn't just to manage symptoms, but to make sure your child can live a full, active, and happy life. You'll see that effective management makes all the difference, and that's exactly what we're going to dive into.
Okay, so asthma and allergies. Yeah, they can definitely disrupt everything from play dates to a good night's sleep. But the good news is they are incredibly common and very well understood by doctors. So first things first, let's get a really clear picture of what we're actually dealing with.
So let's break this down. Think of it like this. Asthma is a chronic condition that's happening inside the lungs. The airways get inflamed and swollen, and that's what causes that classic coughing, wheezing, and shortness of breath. Allergies, on the other hand, well, that's your child's immune system overreacting to things that are normally harmless. Stuff like dust, pet dander, or pollen. Now, they seem different, but the key thing to remember is that they're often deeply connected, and we'll talk more about that in a bit.
So how do you know when it's more than just a regular cold or a simple case of the sniffles? This next part is all about empowering you, so you can recognize the specific signs that mean, okay, it's time to have a chat with our pediatrician.
If you find yourself kind of nodding along as we go through these, that cough that always seems to pop up at night, or those cold that just always seem to settle in their chest, these are really clear signals. These are not things you just wait and see about. They're your cue to get a professional opinion and start getting some real answers.
The whole idea of a doctor's visit, especially with tests and things, I get it, it can feel a bit daunting. But I want to reassure you, this is a calm, really thorough, and highly personalized process. It's designed to help, not to intimidate. So, what does that first visit actually look like? Well, it's a pretty logical process. It all starts with your story, a detailed history of everything you've been noticing. From there, depending on your child's age, they might do some simple, non-invasive lung function tests. And if allergies seem like a possibility, testing can pinpoint the exact triggers. See? Each step just builds on the last, and it all leads to the most important part, a customized plan made just for your child. And the result of that consultation isn't just a diagnosis or a prescription slip. No way. It's a full-on, clear, and customized plan. Think of it as your family's roadmap for managing this whole thing effectively. And this is so important to understand. A good plan goes way beyond just medication. Of course, medications like inhalers are a key part of it, but so is education on how to use them correctly, and practical advice for your home environment, plus guidance for school, for sports, even for travel. It's a holistic approach, a real partnership that empowers your entire family. All right, let's tackle some of the biggest questions and myths that parents have. Because getting a diagnosis absolutely does not mean a life of limitations. In fact, with the right plan, it's pretty much the exact opposite. This is probably the #1 question parents ask. You see your child getting short of breath after running around, and your first instinct is to protect them, right? To tell them to stop and take it easy. It's totally natural. And the answer, I'm happy to say, is a firm, reassuring absolutely not. The goal is never, ever to restrict a child's life or their joy in just being a kid and playing. Because it all comes down to management. With the right plan in place, like maybe having medication on hand or knowing to use it before they exercise, a child can fully participate in whatever they love to do. Good care enables activity. It never prevents it. Okay, next up, allergy tests. The idea can sound kind of scary for a little one, and let's be honest, for us parents too. You're probably wondering, are they safe? Do they hurt? The short answer is yes, they are very safe. These tests are always done by professionals in a controlled, supervised setting. They're designed to be as gentle as possible while giving you incredibly valuable information. They pinpoint exactly what's triggering your child's reactions so you can actually do something about it. We kind of touched on this earlier, but it's such a crucial point that it's worth asking directly. Are asthma and allergies truly separate things, or do they actually influence each other? And this right here is exactly why a comprehensive plan is so vital. Uncontrolled allergies can absolutely be a major trigger for asthma flare-ups. So by getting the allergic reactions under control, whether it's to pollen or dust mites, you can often get much better control over the asthma too. They really can be two sides of the same coin for a lot of kids. So let's end on this powerful and, I hope, very reassuring thought. With the proper care and a good plan, most children manage their symptoms incredibly well. They enjoy the same active, healthy, fun-filled lives as any other kid. It's not about limitations, it's all about empowerment. So, I'll just leave you with this to think about. What could more peaceful nights and more energetic, carefree playtimes mean for your family? A personalized plan isn't just about managing a condition. It's about unlocking a healthier, happier life for your child. And that's really the key takeaway from this entire explainer.